So here's the surface anatomy. It's a little disproportionate, but it's okay. So what we can see here is the jugular notch, the clavicles, here's the sternocleidomastoids, and there's the larynx, and the deltoid for the shoulders, the axilla for the armpit. What you will see, this big area here, and there's the nipple. The big area here, this is the pectoralis muscle. Okay, now the pectoralis muscle consists of two portions, the clavicular head and sternocostal head. So clavicular head, which comes from up here from the clavicle and goes right and attached to the humerus. The sternocostal is all of this area here, and it goes and also attaches to the humerus. Then you have the muscles here, which consists of the teres major from the back, which we will not discuss, but also the serratus anterior and the latissimus dorsi, so both of which are in this area here. Beneath the pectoralis muscle, so the pectoralis muscle in this area is called the pectoralis major and consists of the clavicular head and sternocostal head. If you cut it and reflect it, you will see a pectoralis minor, which is located underneath the pectoralis major, and the pectoralis minor would be coming from the coracoid process of the scapula and attaching to the ribs. So here one more time, removing the skin and seeing the actual muscles. So this here is the pectoralis major, consisting of the clavicular head from the top. It's just like a triangular shape that attaches to the clavicle, and sternocostal head here, which attaches to the sternum and the costal cartilages, I think 1 to 6, and also going to attach the humerus. So this whole thing here is the pectoralis major. What you see here, this here is the external oblique muscle of the abdomen, and this area here, this is where your costal margin is, so the rib, okay? The margin of the ribs is called the costal margin. Then back here you see the latissimus dorsi, which has been reflected here to show you the serratus anterior muscle. You can see the serratus anterior muscle on yourself. I don't know, in the male you can see it clearly. If you stand in front of the mirror and raise your hands or just flex or something, you can see this portion here of the serratus anterior muscles, and they are coming from the scapula and attaching to the ribs as well, just like the external obliques and just like the pectoralis minor, they all attach to the ribs.